sure that's, okay, there we go. And we're starting into a totally new topic now that relates to how do we kill microbes on purpose, is kind of the focus of this week of lecture. So when we talk about control methods, that's really ways to kill or reduce numbers of microbes in different ways. And there are three big ways that we could do that. We divide these into physical methods, which is today, chemical methods is going to be for Wednesday, and then a category that we refer to as drugs. So before we get into that, I kind of want to explain, like, how do you differentiate these from each other? All of the physical methods have to do with some kind of physical force or a process that we are subjecting the microbes to that has nothing to do with any kind of chemical. So this is going to be stuff like heat or radiation or filters or things that is a physical process. These two are both related to chemicals. Drugs are chemicals. Chemicals are chemicals. But the difference between these is in the amount and where we put the chemicals. If it's a drug, the chemical is going into the body. Into the body in a low amount. If we classify it as a chemical method, it's going onto a surface, which might include a body surface, but we're going to use a larger amount of that chemical. Always useful when you guys squint and I can see that you can't see the marker well enough. Thank you. we started teaching Noah to drive. And I realized the first 2 times he's like, oh, I guess I need to be wearing my glasses. I was like, yes, you need to be wearing your glasses. So later, if you have any tips for like, what do your parents do to teach you to drive? This is like scary. Yeah, started at church parking lot, and then the elementary school parking lot, and around. I'll let you know how that's going. Okay, so that's kind of the 3 big divisions, and today is about physical control. So I have a story to tell you about control methods, and it also has to do with Noah, who's the oldest, but he was our first child, and so we brought him home from the hospital. And with your first child, like, you buy the good special wipes, like not the Sam's Club, and they're soft care and all that. And Dr. Han Ong is very poop phobic. He always has been. So he was over there changing Noah's diaper, and he had the wipes, and he was using like a lot of wipes, and he was just grossed out. And he said, "Do these things have any sterilizing power?" And I always remember that, because that use of the word sterilizing, like, that's kind of how the general public thinks of sterilizing. These wipes do not have sterilizing power. They are not that powerful. And you would not want to use something that powerful on an infant hiney, let's say. So what we pick out of these methods that would be appropriate for the situation It depends, like, what are you trying to accomplish, and what are you using it on, okay? So choosing these, or choosing a method, depends on your goal. Like, how clean do I need that to be? I don't need my baby's butt to be sterile. I just need the poop off of it. And it depends on the item to be cleaned. Like, how valuable is that thing? Should you just throw it away, or should you try to clean it in some way? It depends on the money that you have available. And it depends on other factors as well. So something that I will ask you all on your final exam, the exam for this section, is I will describe a scenario, and then I will want you to pick out some way to clean that thing to some level and explain why that. For example, if this thing still has the whites in it, I don't know. If it does, they're not cooking up anymore. But I could use that as a baby wipe. I could use that as a table wipe. I could use it to prep somebody for surgery. I could, but those would not be appropriate for everything. Just like a baby wipe is not appropriate for everything. And like hardcore bleach is also not appropriate for everything. So picking out a method, it depends on what are you trying to clean, how clean do you need it to be, and then what do you even have access to. When we are trying to clean, disinfect, sterilize an object, we're trying to reduce the number of microbes. And what our goal is will relate to, okay, we want to kill different levels of these different microbes. This is describing how hard is it to kill that microbe. So in general, you could call this side down here where it says less resistant. This would be wimpier, easier to destroy. And up at the top, it's more difficult to destroy. In this class, I didn't teach about prions, so you can cross that off. But the things that we've learned about, endospores are the hardest to destroy, and they're the toughest. And they are the most difficult to kill. Endospores are the most difficult to kill. If you use a method that kills endospores and is good enough to destroy them, it will automatically also destroy everything else on this list. So if our goal is to kill endospores, that's like saying our goal is to kill everything microbial. And killing endospores is actually the definition of what sterile is. So the word sterile or sterile, if you speak British English, or sterilization, has a very specific meaning, and this is a definition that I want you to know. So sterile would be a condition in which all microbes are killed or removed from an object. including endospores. So the conditions to make something sterile are the conditions basically to destroy endospores. And if you have accomplished that, you have already accomplished killing these others as well. There are not actually that many things in life that will sterilize. These would not. So these do not sterilize. Those wipes back there do not sterilize. They're going to kill and remove a lot of different things, but not to the level of endospores. So that's what sterile means, sterilize. You're getting the conditions that kill endospores. This is a definition that you need to have memorized, what that is, what sterile is. And this particular table tells you what sterilization is and what disinfection is, decontaminate, and so on. These, we're going to also write, more everyday definitions in slides coming up. But once we have done that, this is a good review table, and it kind of shows you what kind of things accomplish that level. So this is useful, but it's more useful later after we've learned some of these concepts. This slide is just telling you what does it take to actually kill endospores. I'm going to skip past that. Okay, so sterilize is one thing. Disinfecting is something different. So this is going to be a level of cleanliness, let's say, but it's not the same as sterilizing. A lot of times, if we think that we're really cleaning something well, we're not sterilizing, we're disinfecting. So disinfecting is killing or removing the majority of microbes from a surface. So we disinfect surfaces. But we're not to the level of killing endospores. So we've done a pretty good job killing the other kinds of microbes that exist, but not to the level of endospores. So that would include viruses, most normal bacteria, protozoans, and so on, but not endospores. So say you're getting to this level and everything down. That would be disinfecting. One good news, SARS-CoV-2 is an enveloped virus, and it's really easy to kill on a surface. Those wipes would do it. Dry erase board cleaner would kill, that would kill SARS-CoV-2. Most of the time when we're cleaning things, what we think is very clean, we're doing disinfecting. When you see on a label that substance kills 99.9% of viruses and bacteria, that means it disinfects but does not sterilize. It disinfects, but it does not sterilize. So the 0.1, the 0.1% that they're leaving out, that's going to include endospore formers. The reason that the labeling is like that is that sometime before FDA or USDA or whoever regulates this made companies do that, somebody got sick from an endospore-based disease and they sued the company because the company said that it killed everything. And it got almost everything, but not endospores. So that's why you have this label now. 99.9% blah, blah, blah. It's a disinfectant. And Lysol is an example of that. We have another term that's a little bit different, kind of lower down on the list, that is called decontamination. Decontamination. That's a lower level than disinfection. Decontaminating is mostly removing. So mostly removing. It can also kill many microbes, but it's not to the level of 99.9%. So we've got less than 99.9% gone. And that's, I mean, we've done a pretty good job cleaning that item. We've decontaminated it. But if I spit wiped this, I'm not going to do it. That would be decontaminating. If I wiped it with a wet paper towel, that would be decontaminating. If I vacuumed in here, totally needs to be done. That's removing some microbes. If I went over and Windexed the window, that's decontaminating. When you wash your hands. So we're cleaning the thing, but we're not particularly killing microbes. We're just mostly wiping them off. Or we're mopping them up with the Fabuloso. What's your favorite color of Fabuloso? I like purple the best. That's why I put the purple. Your less toxic cleaners, those are going to decontaminate. So if we say that we clean something, yeah, we do. It could be decontaminating. It could be disinfecting. It could be sterilizing, depending. So microbiologically, we've got better specific words to describe what we're talking about. Decontaminating is also known as sanitizing. Those kind of mean the same thing. Sanitizing, decontaminating. And then we have one more word, one more definition that is really specific in what it means. Antisepsis. And this is removing or reducing microbes on a body surface. Antisepsis. Any kind of chemical or process that we use for antisepsis has to be safe for the body. So this example of antisepsis, maybe somebody has fell down and fallen down and scraped their arm on a branch that had dirt on it or something. And we see that someone is pouring saline over it to try to get the dirt out, just to wash away some of the contamination. So that would be antisepsis. If you have a patient and you're swiping their arm with alcohol before you give them an IV, that's antisepsis. If you swish Listerine in your mouth, that's antisepsis. So this implies that we're doing it to a person's body. And chemicals that we use for antisepsis need to be safer than decontaminators or disinfectors or sterilizers. So when we're using any of these methods or any of these chemicals or processes, we're trying to reduce the number of microbes. We might also be trying to kill the microbes, but we've got some different terms that describe, are we stopping them from dividing, or are we actually killing them? So we can, if a chemical or process kills microbes, we can call it microbicidal, like suicidal, but microbicidal. If it's microbistatic, that chemical or that process is going to prevent the microbes from dividing and hold their numbers steady. So that gets us some definitions that we need to go now and talk about the different methods. This flowchart is describing what are some different examples of each method type, and then giving you some color coding about what level of cleaning is it doing. So they're listing some methods in blue if they disinfect, in red if they sterilize and get to that level, or in yellow if they do antisepsis or sanitization. This, again, is going to become more useful as a study chart after we've gone through all of it. So come back to this. This is a really good overview study chart, but I want you to do one thing to this. Draw an arrow, if you've got this picture, and include mechanical removal with physical agents. Different books classify these different ways. I'm putting mechanical removal together with the physical agents. So please make a note of that. Now we're going to start the section that's actually about the physical agents. We've got 3 different categories of physical agents that we use to do microbial control, and they have to do with either heat is the first category, or it has to do with radiation in some way, or it has to do with filtering. Those are going to be the 3 big groups of physical control methods. And we'll start with heat. All the heat methods have in common that you're going to raise the temperature and make it bad for the microbes in some way. So we're going to heat them up to kill them. And we can divide the heat methods into either it's moist heat or it's dry heat. Moist heat kills microbes by denaturing their proteins. So if the protein or the enzyme of the microbe is supposed to have this shape, and you get it hot enough, it's going to ruin the shape. So moist heat methods do that. And if you can get something hot enough, you can kill a certain microbe. If you get moist heat hot enough to kill endospores, it would sterilize. But that's not always the case. We have three major moist heat methods, and the first one is just to boil something. So if you boil a liquid, that's a way to reduce microbes. How hot does boiling get? In Fahrenheit or Celsius? What's boiling temperature? 100 degrees Celsius. What about the Fahrenheit?
That's a lot.
It's high. 212. 212. So that's the temperature that water boils. Notice back here, what temperature it takes to kill an endospore. 120 degrees Celsius. So boiling will not kill an endospore. It will kill almost everything else, but not an endospore. So boiling is considered disinfection, but not sterilizing, just plain boiling something. There's another moist heat method that's called pasteurization. What kind of stuff gets pasteurized that you eat or drink? Milk? What else? Definitely milk. Pasteurized cheese product, like American cheese. Some juice gets pasteurized. What pasteurization is you're heating up the food or the fluid or the substance. You're heating it up somewhat so that you reduce the microbial numbers. But you're not heating it up so much that you lose the taste. Or the texture. You could just full on boil the milk and kill more microbes, but it wouldn't be milk anymore. It would be liquid. So pasteurization, you're kind of heating it up somewhat, and then you cool it down some. And you may do a few different cycles of that, but it's less than boiling. It's a weaker method. The advantage of it is that you don't destroy the nature or the texture of your food. But the disadvantage is you don't kill as many microbes. So this stuff would have a quick expiration date. You can take your jug of milk or your carton of milk, and it's got microbes in it. And they're going to keep growing in there. And maybe around the expiration date, they might start to become dangerous, or they might spoil your milk. If we heated up the milk enough to kill all of them, it wouldn't be milk anymore. So pasteurization is a taste versus safety kind of trade-off. It's pretty weak, but it's technically a heat-based method. And then our third heat-based method is more intense, and it's considered sterilizing. And depending on where we're doing this, we can call this autoclaving, which is this word up here. Pressure cooking is that same thing. These days, an Instant Pot is the same thing. Is that right? Instant Pot? Or is it Instapot? Okay, I don't have one. That's why I don't know. Those are all the same thing. So what these are doing is going beyond boiling enough to sterilize. And this set of techniques is reaching the conditions to kill endospores. So we will get the temperature up to 121 degrees Celsius. For 15 minutes. That's enough to kill endospores. That'll do it. The trick is, how do you get the water, how do you get it that hot? So to get water that hot, you have to create steam under pressure. If you're just boiling water in the normal atmosphere, as soon as it reaches 100 Celsius, it's going to start evaporating. And then it can't get any hotter than that. It will never get hotter than that. But if you put pressure over this, or you pressurize this situation, the water will get hotter before it boils. That way, you can make steam at high temperatures, enough to kill an endospore. So if you have a big system like that, you call it autoclave. So that autoclave in the lab where you put tubes, it's got water, it's got a really tight sealing door, and it's got some machinery to close this, close it off very tight, heat up the water, make it boil, but it's a pressurized system. So it'll get hot enough to kill anything. Everything in our waste bag goes in the autoclave. Same for your Instant Pot. Maybe I'll use them. You know, at the end, you have to kind of like release the pressure. So because it gets so hot, it'll cook stuff faster. It would also sterilize more than boiling would. So all of those have to do with you get steam under pressure in some way, and that will give you the conditions to kill endospores. The pressure that you have to get is 15 pounds per square inch. All of them would be accomplishing that. So those are our three moist heat methods. And check back at this. So it's a physical method, heat, the moist variety. You have to get the steam under pressure if it's considered sterilizing. If it's not hot enough, it's disinfecting, and that could be from boiling or from pasteurizing. All of those would reduce microbial numbers. They're moist heat methods. So now we're going to look at the dry heat methods. Dry heat just burns things up, basically. You're just burning stuff to a crisp. And the other, there's two versions of this. you can incinerate, which is to basically burn the object, catch it on fire. So when you flame your loop, that's incineration. And you're just burning every life form that's on there. It does sterilize. It's going to get hot enough to kill anything. There's another option to sterilize with dry heat that's just called dry oven. This would be like your house oven, or in a lab setting, if you wanted to sterilize like metal or glass, you would put it in just a really hot oven and just let it cook and destroy all the microbes. So we would just raise the temperature in that oven above 121 and hold it there, and that will kill endospores. You just have to make sure that what you're putting in there is not going to catch on fire. So we would use this for glass or metal. You can put surgical tools in there after they're already cleaned off and sterilize them that way. But it's not useful for everything. It's got to be durable stuff. That would also sterilize. So this set are kind of stuff that you could do at home with what you have. You could use your own oven at home to sterilize something that's really durable. These next methods are a little bit harder to use at home, and they're a little bit more specialized. They use radiation. In some ways, these radiation methods are we're going to aim some energy waves at the object, and the energy waves are going to kill all or some of the microbes. And we would be using some type of energy out of our electromagnetic spectrum. Which side of this has more energy, left or right side? The left. So these would be the most powerful. These would be the least powerful. And draw a line right here, somewhere around here. Like this is starting to have enough energy to actually kill anything. These, not so much. Like you could put food in the microwave and cook it, but microwaves on their own are not always powerful enough to kill microbes. So UV, X-ray, gamma ray, once you're at this level, that's enough to kill a lot of microbes. And we divide radiation methods into ionizing, or non-ionizing. If we say that radiation is ionizing, that energy wave is strong enough to knock electrons off of the object. So that's the more damaging type, ionizing radiation. That's the kind when it needs to have a warning signal on it, like, watch out, this could knock electrons off of your body. It's ionizing radiation. that would include X-rays, gamma rays, beta rays, and ionizing radiation, we don't have that. The average person doesn't have that at their house. I mean, I hope you don't. Shady if you do. So these would be used in industry or hospital settings. People go in for cancer treatment and have radiation, they're getting gamma and beta rays specifically aimed at their tumor to kill it. You gotta be careful where you aim it. Ionizing sterilizes. It's strong. It would definitely kill microbes, but it's dangerous. Not everybody has access to this outside of a hospital or a factory kind of setting. There's a weaker kind of radiation that we call non-ionizing. And that version specifically damages DNA. This kind of radiation, the energy waves hit the DNA and they're at the right wavelength that they cause damage to the DNA. And they end up making mutations in the DNA. And the type of radiation that does this is UV, ultraviolet. UV light can kill microbes if you aim it at them enough and if they're directly getting hit by it. So this one, whether it's sterilizing or not, it depends on the conditions. And on here, they are classifying UV as a disinfectant. It normally is. There's a few situations where UV could sterilize, but it has a lot of different requirements. So I'm going to put this over here and just make a note that UV usually does not sterilize unless usually does not sterilize unless the following situation. So UV will not penetrate deep in the surface. It only hits the top of the surface and then it kind of loses its energy because of its wavelength. So you could use UV to sterilize something like a table, let's say. So if I were to wipe off this table and get all of the eraser stuff and all of the whatever else this is off of it, and the surface had no layers. And then if I shone UV light all over this for a long enough time, I could sterilize this surface. But gross, but say that somebody threw up on the chair and we were to clean up the vomit off the top of it, but it was down in the depths. We could not sterilize the chair with UV because it would only get the top surface. It wouldn't get what's underneath. So UV helps but it can't penetrate surfaces. Or let's say it can't penetrate depths. When you guys work in the hospital, hospital settings, medical settings, you may sometimes see up toward the ceiling there's UV lights, like aiming across the room and shooting through the air up there. That's to kill microbes that might be floating in the air. And they're supposed to not shine in your eye because it could make you go blind if you look at that all the time. UV is useful for disinfecting air, and it can disinfect surfaces, but it doesn't usually sterilize. It mostly disinfects. It can do a decent job of reducing the microbial numbers. And then we have our third physical method, which is different than the others because it doesn't actually kill anything. It removes only. This one's easy to understand. Everybody's seen filters. So filters are going to pass a liquid or air through a substance that's going to have little holes in it, let's say. And microbes will get stuck in the filter, and the air or the liquid will keep going on through. Whether filters, liquid or air filters, whether they sterilize depends on the size of the hole or the pores. So that's going to depend on the filter's pore size versus the size of the microbes. So you can get air filters that sterilize the air, but they're really expensive, and they're going to get clogged up really quick because their pores have to be so tiny that they're letting air through, but not microbes. They exist. Most people don't use those. They're too expensive. You can also buy liquid filters that have holes, pores in them that are way tinier than viruses and bacteria, and they will sterilize your liquid. But they're also expensive, and if you are trying to filter something that's just really lousy with bacteria and viruses, the filter is going to clog. Any of you have a life straw? You ever heard of that? You take it with you camping, and it's a straw, and it's got this little filter in it, and you can take it and drink out of a creek. That's what they're doing. You would not want to use your life straw to like drink out of a muddy puddle because it's going to clog really fast. But that's cool. That's how this works. They have holes in them that let water through, but not microbes of a bigger size. So filters can sterilize if the holes are small enough. They're mostly just trapping microbes. This one, your chart says that air is decontaminated and liquids are sterilized, but I would have you write under here, it depends on the pore size, totally. So not every liquid filter, like a coffee filter, it's a filter, it's not sterilizing. It just depends on the pore size. So what I want to do now that we've gone through, here's some physical methods that you can reduce microbes, is to, maybe won't have time. I want to talk about what kind of things tend to use these methods. As many as I can get to in 3 minutes. Okay. Boiling, we're familiar with that. We cook food that way. Pasteurization, we kind of get that. Autoclaving tends to be used in certain situations medically. So this would be when people actually use autoclaving in a medical situation. So in our lab, we use autoclaving to destroy microbes that are in solid hazardous waste. Before we're going to throw that away. So in our class, almost everything that we put in the autoclave, we're going to throw it away later. Because the autoclave is pretty destructive. So we could use it that way. We can use the autoclave to sterilize media, whether it's agar media or liquid media, before we put it in the tubes and the plates. So that's a reason we would use autoclave. The other place that autoclaves are useful is to sterilize metal or glass medical equipment. Especially surgical tools. So every dentist's office has a little autoclave back in the desk where after they clean the dental tools, they'll put them in the autoclave, subject them to 120 degrees Celsius for 15 minutes, 15 PSI, so that the next person that they're going to use that pick on, that, I don't know what you call them, the things they scrape your teeth, it'll be sterile for the next person. So autoclaves are good for that too. They would be used in these kind of settings. Medically, incinerating is only for stuff that you're going to throw it away, basically. So, except for flaming loops, that's incinerating. How many of you work at a hospital right now or a nursing home? Do you know what goes to the incinerator? Did they ever tell you?
They don't tell us much, but like if something happens, a spill or something, you have to use biohazard like that and come to it themselves. We don't take it.
Yeah. So hospital setting, stuff that goes in the incinerator would be kind of like less stuff that's a little bit less contaminated, but it's kind of big. Like, say if somebody had Ebola or something like super dangerous, and they got it all over the sheets, they're not going to try to wash those and reuse them. They're going to go to the incinerator. Or like when you have bulk medical waste that you need to throw it away, but it's too big to fit in the autoclave, it would go in incinerator because it's cheaper to run. It's like a large furnace. So it tends to be stuff that's big and you're not going to use it again and it can totally get burned up. That's incinerator. So we'll start back with this Wednesday. Let me know if you have any questions about presentations or unknowns before tomorrow, but I will see you guys at your lab time tomorrow in Whitehall. I'm looking forward to hearing those. It's always fun.